So one, it'll have to be ortho.
Okay.
It's very satisfying work. So you have, because a lot of what we do is related to mobility and independence. By the time you're meeting a patient, they're at a point where they're struggling to move around, or they're struggling to get some stuff done. And so if I can play a part in getting them back that independence, usually it's the most satisfying thing. Then you get to play with cool tools.
I told you guys they are carpenters.
I mean,
What are some of the things that you're seeing today when it comes to bone health that people are either prioritizing well or missing the mark?
supplements are accessible anywhere. The thing is, if you have too much of something, it's poisonous. So you've had guys who are on calcium supplementation and then end up with kidney stones. I mean, you just had too much. And you didn't need it. So
and kidney stones are painful.
Anything that interferes with our menstrual cycle, anything that interferes with our hormonal balance, has a direct impact on our bone health.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough health information to help you make an informed decision. As always, my name is Dr. Hope Simiyu, and today I have a lovely guest. I'll let her introduce herself. But before we get there, I always forget to do this. This is an invitation to subscribe, to follow us wherever you listen to your podcasts. Please, bonyeza that button. I'll give you 30 seconds. 30 were too many. But now let me let our guest introduce herself. We've been yapping and we're just looking at time. We're like, hey, but go on, girl.
Hi. Thanks for having me.
You're welcome.
First time experience. So feeling like a fish out of water, but excited. I am Eva Langat, professionally Dr. Eva Langat. I am an orthopedic and trauma surgeon based in Nairobi. I primarily do a lot of sports orthopedics because it's a passion of mine. Occasionally, I'll do a bit of trauma here and there, but my main focus is sports medicine. I am a wife. I am a mother of one. I am a daughter. I am a friend. I'm a child of God.
Amen.
So in a nutshell, that's who I am.
Okay. Karibu sana to the podcast. And before we start, we usually just want to do a pulse check just to get a feel of where you are. So I don't know if you've watched Inside Out, the movie.
Have I?
Or heard of it. Have you heard of it?
Yes.
Okay.
So I'm the person who would go Kitambo for libraries. I would rent the same movie twice because I don't remember watching it. So it's a problem.
Okay. Let me tell you what it's about. It's about emotions, basically, and why we are the way we are. So I just want to get to know, where are you emotionally and mentally today, right now?
I'm feeling calm today. I think, well, maybe weekend. I don't work weekend, so my work brain shuts off. So mentally, I feel like the noise that has been there throughout the week is quieting out. Emotionally, I'm feeling good. I'm happy. I'm excited. Had a bit of an anxiety-inducing week. But I feel like I'm getting into a calm space. Therapy helps.
It does.
So,
But I think also your personality is just very calm, very zen. Just from the 1 hour that we've been interacting, you're very which is nice.
Calm has never been used as a
Really?
Yeah, well, I'd be good in crisis.
Okay.
Yeah, but thanks. That's something new to add.
I guess that's why you're in trauma surgery.
True.
Good in crisis.
Okay.
I think for me, I'm excited. First of all, we haven't shot in quite a while, and I was tired, but for some reason, the podcast just makes me not tired. It energizes me. So I'm excited to be back and just happy to have new conversations. And because I broke my foot last year.
Oh my, what were you doing?
We'll get to it. But like a trauma surgeon, an orthopedic surgeon is a person I've always wanted to have on the podcast. So really excited for this conversation.
Nice.
All right. Now, what is song to the doctor's seat? Huh?
Okay.
Just some questions. Don't overthink
Feels
it,
like
please.
the hot seat.
Yeah, don't
Okay.
overthink it. It's just random questions. Just give me your thought process around them.
Okay.
All right. So the first question is, if you had to explain what you do to a 4-year-old, maybe you can picture your son, how would you describe it in one or two sentences?
I fix people's ouchies. Pretty much that's what I do.
I feel like that has been said, but that's
yes,
nice.
because that's what I mean. That's what we would tell him.
Yeah.
Pretty much when he was younger, it's you have a hurt hand or a broken leg, and so that's what mommy does. I will fix it or put you back together and help you walk and move again.
Yeah.
Yeah. So it's been done. So that's why it came pretty quick.
That's nice. That's
Yeah.
Has he ever broken anything?
No, and touch wood, we do
Always
not.
wood,
He's
yeah.
a boy.
Yeah.
So, yeah, and pretty energy.
Filled.
Yes, energy filled. But interestingly enough, so we let him do dangerous things carefully from a very young age. So climbing and helping himself come down and do that kind of thing. So he may look like he's very chaotic, but he will duck the corner of the wall just in time. So I'm hoping we don't have to use the expertise or get friends to sort him out. But I mean, if it does, we know who to get him to.
There you go. Okay.
Yeah.
Next question. If you were to rate your top 5 medical specialties, the ones you like, you can include ortho or exclude it.
Okay.
Which ones would they be and why?
So one, it'll have to be ortho.
Okay.
It's very satisfying work. So you have, because a lot of what we do is related to mobility and independence. By the time you're meeting a patient, they're at a point where they're struggling to move around or they're struggling to get some stuff done. And so if I can play a part in getting them back that independence, usually it's the most satisfying thing. Then you get to play with cool tools.
I told you guys they're carpenters.
I mean, it's pretty fun work.
Yeah.
But also,
Yeah.
in the line that I've picked, we don't have very many emergencies. So for those who like structure in your life, it's possible to do it that way. Of course, you may miss out a bit of work when you think about the financial side of things. But if quality of life is something you're keen on, then I can easily tell you, you've got please let's meet in the clinic on Monday.
Yeah.
We'll figure it out on Monday. So ortho is 1. 2. So this is informed by my experience in residency because part of our residency involved going through different departments. Urology. Interesting. So the plumbing and waterworks department.
Wash as well.
Okay. But the urologist we had, so I trained in Kijabe.
Yes.
And he looked like he had life figured out.
Oh.
He would check into theater at 8. By midday, he's done 4 cases and he's done. And then emergency would be something a resident can sort out. So why is he? You see how I don't like
life is important.
Yeah, I don't like waking up in the middle of the night. So that's 1.
That's 2.
That's 2.
Yeah.
Then 3 would be what? I think internal medicine.
Okay.
They get to know a lot, but it's always like solving a puzzle. So if you like mystery and you like problem solving, I think you get a kick out of doing internal medicine.
Yeah.
I enjoyed it as a student. I enjoyed it as an intern. I just didn't see myself sitting in a clinic Monday to Friday, 8 to 5.
Yeah.
Not my life. What else?
Number 4?
Number 4.
If there is number 4.
Wow. I'm struggling to find a number 4.
Okay.
I would think.
No, you can say you're done if you're done. Like this one.
Yeah, I think I'm done because
okay.
The first thing that came to mind is radiology, but I like interacting with patients. So there's the cool side of it where you get to see beyond what I'm seeing in the physique.
Yeah.
And I get to probably figure out what's going on in there. But then the fact that I don't get to interact with patients, I like the patient's
interventional
story.
radiology, maybe.
No. You get to wear lead jackets. Already know, so that's just smart.
Yeah.
But yeah, I like to know the story. I like to know,
Okay.
oh, where do you come from and what do you do and what do you
Yeah.
have on your farm, and so that's part of the conversation. Like for my history taking,
Yeah.
that's part of the stuff I like to do.
Okay.
So I like patient facing specialties.
Mm-hmm.
I don't like emergencies. I don't like waking up in the middle of the night. I like to structure my life so that I'm present, because the residency was tough in that I was not present for a lot of family stuff. So I figured if I can do that now as a
Yeah.
consultant
Yeah.
and be there as my child is growing up and be there to do homework, and that's the life I want to live.
Okay.
So yeah, so we'll
We'll cap it at those three.
yes.
Okay. Okay. And your type A is really showing.
order structure.
Now, the next question is, if you won a grant today, what problem are you solving?
Wow, that's a very good question.
Who has said? Someone has said, here is $5 million. Get to work.
Wow.
And it doesn't have to be in Otho.
Yeah.
Yeah.
I think so. For me, the one thing I get to see or to experience is a lack of information out there, which I mean is a problem you're already solving.
Yeah.
I'm seeing a lot of that, particularly with young athletes, because I see a lot of young. We now have this big thing towards sports, and the sports is a way out for our children.
Yeah.
But
Project Mbappe.
it's a retirement plan. So it takes a lot, because like I told you, my son is very energetic, so he's also very good at certain things. But reigning that desire that we start now.
Yeah.
So I see a lot of injury in that age population. Okay. And a lot of it is just lack of information. So I'd actually, my biggest thing would probably be advocacy, particularly health advocacy around sports.
Okay.
Particularly for kids. What is safe? When is it safe to start? What is too much training? That kind of thing. So if we can inform and educate, then we can prevent a lot of the stuff we're seeing now.
Okay.
So I think that's what I would probably look to do. Yeah.
I'll definitely plan for that conversation for the future.
Yeah.
I think it's a very valid one. Yeah.
So one of the things I do with the group, we're part of the Sports Medicine Society of Kenya. So part of our mandate is that advocacy for safe sports and advocate for the athlete regardless of age and where they are in performance spectrum.
Okay.
So we bring together doctors, physiotherapists, sports psychologists, sports nutritionists. So if we can get all these people in one room and every parent knows that these are the people your child needs to perform at that level, I think then we will see a lot more. I mean, we're an excellent sports producing country, but I think we have not, by any measure of the imagination, we have not achieved what we can in terms of potential. And we lose out a lot on our athletes because of just incorrect training or access to healthcare. I mean, high schools where kids dislocate shoulders and they're told, just push it back, go back.
Yeah.
And then down the road, this is someone who could have performed up to probably Olympic level, but because of injuries sustained that could have been sorted out when they were younger, now that their career just ends there. So for me, it would probably be education and advocacy around sports, particularly for the youth.
Okay.
Yeah.
Lovely. I think that's brilliant, because I think we really need to celebrate our athletes more. They're doing such a phenomenal job. And if you can churn more into the programs, I mean, why not? Yeah.
They are possibly the one thing that I think every Kenyan will be united and say, these are the guys who fly our flag.
Yes.
Regardless of whatever is going on at home.
Yeah.
We're celebrated the world over because of these people.
Exactly. Okay. Next question. Oh, let me answer mine. I think for me, my answer always changes. But I think right now, just because we are seeing, of course, there's hantavirus, there's Ebola going on, and it's not the first time we're hearing about Ebola. I think we need to focus on emergency preparedness because it is a part of primary healthcare, and somehow it always just makes us lose balance. So I think if we can focus on that so that when we have these emergencies that we need to focus on, there's already something that's allocated for that and we are already prepared to handle them.
I think so. That's brilliant. I think it involves an entire paradigm shift as a people. We are reactionary.
Yes.
In everything.
Yeah.
So when you ask someone, do you have health insurance? And they're like, no, but I'm fine. I keep telling patients, disease and accident don't tell you they're coming. So you have to prepare for that eventuality.
Yeah.
So it's the same mindset as a nation.
Yeah.
If you do not prepare, it will definitely
That's
hurt
true.
you. Yeah.
That's true. And in the global south, many of us, it's like our healthcare system can be so expensive that we don't really have the capacity to afford accidents. But if you can prevent and protect yourself in any measure or form, it's very important that you do.
It is.
Yeah.
Yeah.
All right. Then the next question would be, what's one skill or one habit that you feel makes you a good doctor?
Would it be skill or habit? I think I think I'm empathetic. I see beyond the injury, or at least I aim to, or I strive to at any given time.
Okay.
I'd like to know who is hope outside of knee pain. What does this knee pain mean to your life? So that when we're coming up with a plan of figuring out what we're going to do, we are taking that into consideration. Having been a patient myself, and I mean, I've had a brilliant doctor. Feeling that you've been heard and you've been seen, I think has made the difference. Particularly, I guess also because I'm a doctor, I can cherry pick who I want to see. So if I have, this is my obs guy and I like her because A, B, C, D. This is my ortho surgeon and I have gone to him because of this and the other. And picking those skills or those soft skills from the people I admire, I think has helped me be a better doctor. My patients keep asking, how do you remember where I live and how do you remember what I was farming? And I'm like, but it's who you are. So having walked the journey of a patient, I think has also helped. Because it's very easy to be, take this and I see you in 2 weeks. But I try to go above and beyond. Of course, then it comes with the emotional, I don't like to call it baggage, just the emotional aspect of, okay, your problem is our problem now. So then figuring out ways to then decompress after, which I think is a much smaller problem than having a patient base that is unhappy with you.
Okay. Now, last question before we now start the the episode. Our episodes usually come out on Wednesdays.
Okay.
And we are trying to do Swahili Wednesdays.
Okay.
So, ukitumia lugha ya taifa, tueleze mada ya leo.
Mada ya leo tunazungumzia afya ya mifupa.
Simple, bone health. Hey, we've been working on it. Some of the comments we've been getting is, ay, madaktari, Kiswahili. But we're doing better. We're doing better. All right. So let's just go into the episode. So we want to talk about bone health. Of course, touching on osteoporosis and osteopenia and just bone health overall to see what are some of the things that we're probably missing as patients and now focusing on the pillars of health. Of course, socioeconomic status comes in, there's diet, cost of living is high, capitalism is a thing, so we're not getting enough vitamin D. So we just want to have that conversation to see how we can optimize our bone health. And even as women, because our reproductive health is always just there trying to fight us.
It makes us, it's our superpower, but it's also our Achilles heel.
Exactly. So what are some of the things that you're seeing today when it comes to bone health that people are either prioritizing well or missing the mark?
In the recent past, I think probably in the post-COVID era, there's been a big push towards healthy living. You're seeing, so it's very interesting. COVID time,
Yeah.
because of that, now we're seeing a lot more injuries.
Okay.
Because now guys who have been sedentary have now decided to start working out. So then they get injuries because of that, or they were spring cleaning and climbing ladders and came tumbling down. But in the time after that, there's been a big push towards healthy living. So people have changed their eating habits. People are actively exercising or engaging in one activity or the other. I've seen online, and I suspect you've seen the same. There's also been a big push towards supplementation and what can we take in terms of supplements. I can tell you for a fact that probably if I see 10 patients in the clinic, 5 to 7 of them are actively exercising. So they'll tell you, now I started to walk or I jog. Also, maybe the numbers are skewed because I see a lot of sports people or athletes, whether professional or amateur. But that is very different from the past, where most of the time people who would come to hospital because of bone pain are old shushus and grandpas, or guys who've fallen, gotten accidents, injuries of that sort. So I think the health, being in charge of your health and taking control of health is now a big thing, which I think it's an exciting time to be a doctor. Because for me, an informed patient is always the best patient to interact with. A patient who is invested in their health. So they'll ask you the right questions, they'll do the right thing, they'll eat the right thing. That becomes an easy person to deal with. Because I'm not pushing you. I'm not, it's like, you're told pushing a wall. Because a lot of the time, previously that was the case. Now, not so much.
Now we're working together.
Yes.
Okay.
So we are working together. Sometimes the only missing link is maybe now information.
Okay. And that's why we're having this conversation, because information definitely is power. And I like the fact that you've mentioned that previously we used to see more of the elderly population coming to hospital complaining of maybe knee pain, joint pain or something. But even now, because of our lifestyles and capitalism, where you're in an office the whole day, I have been hearing from a good number of my friends, back pain is becoming a thing. I don't know if you've seen that, and what are some of the things we're not doing right? Because we are having, and you've had the thing for when you turn 30, joint pains, you just know it's about to hit you. Should it be like that, or there are places where we can optimize?
So I keep telling patients, this work from home culture, or the fact that employers realize my workers are more productive if they don't have to commute. They're at their desks by 7 a.m. and they're still seated there at 7 p.m. Is excellent for employers. It is horrible for them, for their workers. Because if you're working in your house, this can be an excellent working space. I am comfortable on my couch. I'm on the floor. I'm in bed. So in terms of posture, just support, we don't think about it. It's where am I comfortable on my laptop, so I'm on my back and working. We don't move a lot. So the most movement some guys are having is bed, bathroom, desk, kitchen. And that's your circuit. And they'll probably be doing that just for a week until you leave the house. Even those who definitely go to the office, you're seated in a chair, 8, assuming you have maybe a bathroom break or tea break and then to lunch. So you're sitting for extended periods of time. That does nothing good for your back, for your posture. So yes, I'm definitely seeing a lot of back pain in the younger population. I'm seeing a lot of that in office guys or guys who work from home. And a lot of it is just you're not moving your body. So I keep telling them, you'll sit in a chair, so you'll get interesting requests. And I mean, I don't fault them. They'll say, I need an orthopedic chair. Or can I get an orthopedic mattress? And I'm like, yeah, it's true. But if you put a bad back in a good chair, you'll still get up with a bad back.
Ooh, punchline. Okay.
So what can I do to fix my back? When you sit in that chair, it's not the chair that's holding you up. It's your core, it's your back. So if these things are not conditioned to do the work you're expecting them to do for 12 hours straight, they'll get to a point and then they'll bail out. And how will they tell you they've bailed out? You'll get spasms, then you'll get pain.
Maybe
You're
you can tell us
stiff.
what a spasm is.
It's a muscle pull.
Okay.
So muscle pull on the leg, I don't know if you'll be able to see my leg. Your leg will probably go straight and you'll be unable to move.
Yeah.
But with your back, the only thing, you'll have back pain. And then when someone calls you, turn like a bus. So you can't turn your neck. You're just the whole body. Yes.
Oh,
and,
okay.
Yeah, because your back is stiff.
Yes.
So for me, you'll come and I'm like, yeah, you'll tell me the story. And I'm like, yeah. My work here is 1%. I will listen, I will examine, confirm there's nothing else going on. But 99% of the work is you. You have to get moving. You have to start physio, then just an exercise routine. Even if it's 30 minutes in your house, get your muscles moving, get your strength and conditioning in, so that then your body is capable to do what you want it to do.
And I've been hearing a lot about strength and conditioning. How relevant is that, especially from an author's perspective, and for just longevity of life? Yeah, and quality of life as well.
So we are a mechanical structure. You have the framework, your skeleton. So we'll talk about that when we talk about bone health.
Okay.
But then I need to move from point A to point B. How do my joints move? How do my arms, my legs, everything? It's all muscle function. And movement is determined by your muscle strength and conditioning. So if you'll only get from your muscle what you have trained it to do. Okay. So it's you teach your body, you train your body, you train your muscle. And so strength and conditioning is key because it keeps your muscles functioning, it keeps them mobile, it keeps your joints stable. Your mobility, your independence is directly related to your muscle function. That and of course your bone health.
Yeah.
So it's a big component of it needs to be a big component of what you do, particularly within certain age groups. So there's a certain age. So they say usually, especially for women after the age of 40, we've usually reached peak max of what we can get, even in terms of muscle bulk and conditioning. But now, how do I maintain that? Because if I don't, then it's just a gradual decline. A gradual decline, then now you start to get joint pain because it helps support your structure. So you have the framework, then you have now you're supporting. So if that is not working, your framework it's constant, of course, outside of now bone issues. But if you're not conditioning your muscle enough that it can support your framework, then you'll struggle. You'll have pain with basic movements. You'll not be able to pick things off the floor. You'll fall pretty easily. I mean, like stumbling and even just regaining that balance and control. It's a factor of just how your muscle function works.
Oh, that's so interesting. Okay. And now, because at least we know muscle is supporting your bones and your joints, so let's talk about bone health.
Okay.
Define for us bone health, if you can, please.
So we'd look at it as the strength or density or integrity of your bone. Okay. So if you think, like the way like rock is.
Yeah.
So I have coral. It has it's type of rock. Anyway. It has a lot of air spaces. You have dense rock that is very hard and it's heavier. So if you think of bone in that way, it's how much strength does it have? What is its integrity? What is its capacity to withstand force? Okay. So I know it may not make sense to a lot of people when I say bone has elasticity to it. When you think elastic, you'll think my hair tie. Yeah. But bone has that because there are certain positions you'll go into and it doesn't make sense that you're holding that position. But it's because then your bone has that elasticity to bend and change. But if we lose that, then it becomes brittle. So any change or any force through it causes it to break. So when you're talking about bone health, we're just looking at its strength, its integrity, its capacity to withstand force.
Okay. And lovely. And now you talked about bone density. And I know there are some people who've gone to hospital and you've been told, oh, your bone density is low. And for us, we think osteopenia, osteoporosis, which might be big terms, but how do we break it down for them to understand?
So osteopenia and osteoporosis are a continuum. Okay. So you get to one before you get to the other.
Okay.
So when we think of bone density, we have what is normal and what would be peak. So we would compare that with someone in their 20s or by the time they get into 30. This is max peak bone density. By 30, you've reached 30, 35, you reached your peak. You can't get higher than that.
Okay.
Then now when you get to osteopenia, it's starting to weaken. So you're starting to lose that strength. You're starting to lose that density or the thickness of bone. When we now get to osteoporosis, it's the end spectrum of that thinning process, where now you hear orthopedic surgeons speak of an x-ray and say, oh, that bone looks like powder, or that bone is like Weetabix. Like I put a screw and it just spinning, it crumbles, or it just disintegrates. So osteoporosis is the end of that spectrum. Again, osteoporosis is a range. Okay, so their numbers are not probably to bombard them with your audience with numbers, but there's a scale that we look at. So if you think 0 is normal, so 0 can be a good number. So 0 is normal. And then on the number line, we have positive and then we have negative. So when we're looking at 0 as our baseline, the further away from 0 in the negative direction I am walking, then the worse my bone health is. Okay.
Yeah.
And so that's what those numbers are. They inform us and tell us, okay, we're either dealing with osteopenia or we're dealing with someone who is already in osteoporosis. And then subsequent assessments is usually to determine, is our treatment working? Okay. So that's why we would then say we do serial exams. Some school of thought say we'll do it every 6 months if you're in treatment, or every year, depending on what we're dealing with, and then monitor. Are the drugs we're giving, are the interventions we're giving actually working, or do we have to change course?
Okay. Lovely. And now that you said you reach peak by 35, Apple, that's peak density.
Yeah, so kuna wengine wetu tuko sasa on the flip side. That.
But how do we maintain that, or how do we ensure we've gotten the best that we can get? I know diet and nutrition is a very important aspect, and you brought in supplements, which of course we're seeing becoming more and more of a trend. But before we get to supplements, which many times is actually recommended by authors like yourself, how can we leverage on diet and nutrition first, and then we'll talk about supplements later?
So allow me to first, before we speak about diet and nutrition, let me talk about activity.
Okay.
Sure. So as authors, we usually say your bone strength is directly proportional to the stress you subject it to. Now let me break that down into English or into Kenya. The guys who walk from Kangemi to industrial area every day, morning and evening, their bone quality is significantly better. Now, this is assuming they have nothing else as a medical condition. Or the part of the walking nation who will walk everywhere. Their bone health is significantly better than I, who will get in my car, drive to the gym, get in the lift, take the lift up to the gym, and then work out. And so they're stressing their bone. There's a lot of high impact activity through that bone. So the more stress you subject your bone to, the higher your bone density, or the better the stronger your bone gets. Okay. So if we're doing that in our 20s, so if you're doing high impact stuff in your 20s and your 30s, as you're achieving as you're moving towards peak bone density. So you're running, you're hiking, you're walking, skipping. As you're approaching 30, you're increasing your bone density. So think about your bone like a bank. So the more activity I do, the more I deposit in the bank. So we could both be the same age at 30, but I have been running, hiking, jumping for years. You have not. I have a better bone bank than you do. Okay. Then now once we tip over after peak, and now we're getting to that either maintenance phase where we're not really adding more. So you have a bit of addition, but it's not in large chunks. And now what we're doing is maintenance. Then that stress continues to be beneficial. Then now for women, there's then another challenge up ahead in terms of just menopause and what that does.
Yeah.
So if you keep depositing into that bank
Mm-hmm.
by way of activity, then your bone health is definitely going to be better.
Mm-hmm.
Okay. This is, of course, assuming at baseline you're healthy and have no other medical conditions, or you're
Yeah.
not on drugs that will affect your bone health.
Mm-hmm.
If you look at your bone, or you think of your bone as a seesaw, you know that thing you used to play with
Yeah.
in the field when you were in primary school.
Yeah.
So it's a perfect balance between bone formation and what we call resorption. So new bone is forming, old bone is being cleared away. So when you're getting to that peak, that balance is there. Okay. Now as you age, it starts to tip more in favor of clearing of old bone, but we're not forming new bone quite as fast.
Okay.
So if I have enough bone density to cover for that shortfall, then you'll find your bone health is pretty stable throughout.
Okay.
Of course, now save for hormonal changes and stuff like that, which we'll talk about.
Yeah.
Now, what do we need for bone health?
Exactly.
Okay, so what are the building blocks?
Yeah.
So
Hey, building blocks. I love it.
you can tell how we play with Legos.
Yeah.
Yeah. So calcium.
Mm-hmm.
It's the single largest component of your bone.
Yeah.
So where does it come from?
Your diet.
Your diet.
Mm.
So we usually say, and the push is, and I believe every doctor is for dietary sources before we supplement. Let's get as much as we can from what we eat.
Yeah.
So what are we looking at? Dairy products. So your cheese, your yogurt, milk, leafy vegetables. Now it's interesting. I love spinach. Spinach interferes with calcium absorption.
Okay.
So you can imagine creamed spinach.
Yeah.
It is like the perfect oxymoron. I have enough calcium, but then I can't absorb it. So I've recently learned that my favorite vegetable doesn't really help me much. So, and grain, and you have fortified flours, you have fortified milks.
Yeah.
So dietary options are the best. Now, vitamin D, sunlight. So then your body will then produce it or process it to what is then active vitamin D. But now skincare, there's also a big push towards, healthy skin and skincare. So sunscreen, that becomes a factor. We're spending a lot of our time indoors because of the kind of work we do. We have shift-based work. So if you're doing night shifts, it means during the day you're asleep, you're at work at night. So you're not getting as much sunlight. Of course, then there's a seasonal variations. We're equatorial, so for us, that's not a big thing. But of course, depending on where you are in the world, then that's also a factor to take into consideration. So because of that, then supplementation of vitamin D becomes an important factor.
Yeah. Can I add to that? There's something I just learned as well. Melanin. If you're melanated, you need to spend more time in the sun than someone who's not melanated. So that's also a factor.
Yeah. So those who look like me.
And me. Yeah, you need to spend more time in the sun. Yeah.
So there's of course then the dietary. So supplementation comes, it's exactly that. We supplement. We're not replacing. We're adding on to what we've already acquired from our diet. So if you're eating a balanced diet, you're getting enough time outdoors, then supplements are not particularly necessary. If you're able to get everything you need, then you don't need to supplement. There, of course, is a subset of the population. So those who are either vegan or lactose intolerant or cannot do dairy, then you will definitely need some form of supplementation. There are those who can't be out in the sun because of medical conditions. Then you'll need to supplement.
And medication as well. Some medication.
Yes. So there are those who are on certain drugs which affect bone health. So then we will definitely need to counter that. So if you're someone who is on steroids for whatever reason, there are those who have asthma and the like and are probably on long-term steroids, people with what we call inflammatory conditions like the rheumatoid arthritis, lupus, you're on steroids for extended periods of time. So to protect your bone, then we'll give you calcium. But you can't give calcium alone because calcium cannot be absorbed in the absence of vitamin D. So whenever someone is giving you a supplement, please confirm if it's calcium. Either get supplemental vitamin D in combination so that you reduce how much you're taking, or have them as two separate things. Because you'll take the calcium, you can't absorb it because you don't have the vitamin D, and then it's just excreted. So it didn't really help.
Okay, that's actually very important to mention.
Yeah.
Okay. Might I add one?
Yeah.
And this is just what I remember from med school. Also, chronic kidney disease.
Yes.
They need to be on supplementation for vitamin D.
Exactly. Chronic kidney disease, people who have malabsorption syndromes like Crohn's disease, celiac, what was it called?
Crohn's, celiac disease.
Celiac disease. So guys who have issues with absorption of nutrients or just absorption within their intestine need supplementation because they're not able to absorb enough from their diet. People who are on ARVs, there are certain subset of ARVs that cause osteoporosis.
Okay.
And the unfortunate thing is we find out down the road, and because this is lifelong treatment, it's important that if you are diagnosed with HIV and started on ARVs, please ask your doctor that, does this drug affect my bone health, and do I need supplementation from the get-go? Because you can go in with healthy bones and then 2-3 years down the road, we are now struggling to fight back osteoporosis. And believe you me, it's a difficult thing to reverse.
Okay. Now, we've talked, so I think bottom line, supplementation is not bad, but then it has a place and a purpose. So I think it's just encouraging us to find out if we actually need the supplements or if we can optimize our diet first, and then if we need the supplements, then we can build on that.
I think one other thing just to say about the supplements is when looking, I hate taking meds.
Same girl.
So if you tell me I have to take a tab, I'm like, okay, let it be one. Okay, one in a day. But something like now for things like calcium, you'll have guys who will give you like prescriptions where it's like 1,500 milligrams of calcium per tablet. Your body can only absorb about 500 to 600. So the rest is discarded. So you have to take it in small chunks. So it's one of those things that twice a day tablet. Or just do the supplement. If you're good at getting good dietary intake and you just need the one tab, 500-600 milligrams tab should be fine if we're supplementing. But the ones that are large, quite honestly, a lot of that is just being excreted because your body is not able to absorb that much.
And I like the fact that you brought that up because I don't think many people mention that sometimes supplements need to be prescribed and the dose is very important. So even I have a couple of friends who've been diagnosed with vitamin D deficiency, and it's so deficient that you can't be on tablets. You need IV. And for that, you need, of course, a prescription. And I think that's why I'm very vocal with saying, please go and have your levels checked to see how bad the deficiency is and what is the recommended dose for the supplementation that you require. So not everything will be over the counter. So you can't skip your doctor here.
And supplements are accessible anywhere. The thing is, if you have too much of something, it's poisonous. So you've had guys who are on calcium supplementation and then end up with kidney stones. I mean, you just had too much. And you didn't need it. So
and kidney stones are painful.
Yeah. We've gone
You've
to
dealt with a couple?
Yeah. Where patients are going to hospital, they're calling you at like 2 a.m., 3 a.m., and they're like, now we're going to hospital now. I mean, it's outside of labor, okay, maybe not to diminish anyone else's perception of pain, but I quite honestly think kidney stones could potentially be a close second, because I've seen a number of guys suffer through it, and
it's unbearable.
I would not wish it on my worst enemy.
But you've talked about excess, but also insufficient amounts. There's some multivitamins that if you look at the ingredients and just the daily the allocation of whatever supplement it is, it doesn't meet the daily dose.
So, yes. But when you think about it as a supplementation, then even if you're getting a small increase, if whatever you're getting from your dietary sources would be sufficient. And this is a small boost, probably
Okay.
either because of activity or whatever other reason you're taking it. I do not fault an under dosing
Okay.
or under prescription of the multivitamin, because it's just that it's a multivitamin. I'm adding on to whatever I've already got from my diet. But if now I'm using it to treat someone
Yeah.
who has, say, osteoporosis or significant osteopenia, then I would be doing them an injustice if I am prescribing it for that and I'm underdosing them.
Yeah.
But if it's someone who's just, I just want to up my nutrient intake, I won't fault that particular brand or that particular tablet, because that is its purpose. I am supplementing.
That's a good
But if
take.
it's for treatment purposes, then it's the onus is on the doctor
Yeah.
to do right by their patient.
Okay.
Yeah.
Okay. Now let's go to being a woman.
Oh, yeah.
Because our hormones contribute so much to bone health, and of course we'll talk about menopause. But is there anything that a young lady needs to know about her hormonal health in relation to bone health?
Okay.
Yeah.
So I keep saying, being woman is your hormone, just your general body. It's your greatest asset.
Yes.
But it can also be your Achilles heel if not well controlled. So for the young female, whenever you think about your period, so depending on what relationship you have with it, there are those who, and it varies. I mean, it could be
does.
the worst time in your life
Yeah.
every month,
Yeah.
or it could be just another day in the month, and life goes on. And then there are those, it's an excruciating experience. And so having to relieve it monthly is also just a nightmare.
Yeah.
But it's very important because so the hormonal balance within our body, particularly hormones like estrogen, are very protective. Okay, they will help with calcium absorption, and protect our bones. So improve. So if we think of the cells that build our bodies as a bone building cells, and then there are those who destroy. So estrogen works primarily by encouraging the ones who build and suppressing the ones who destroy. And so anything that interferes with our menstrual cycle, anything that interferes with our hormonal balance, has a direct impact on our bone health. There's something in sports we call the female triad. Particularly if you look at our athletes. I mean, if you're going to be a long distance runner, if you're going to be a gymnast, if you're going to be, and particularly sports around women, there's a certain body build that is expected or is considered ideal for that sport. So they're very tiny, very lean. And that can be because of probably working out. Yes, so you have a lot of energy expenditure by way of training, but they're also trying to maintain that physique. You have a low calorie intake. So you end up with an energy deficiency. Now that energy deficiency, your body is like, now we need to survive and we need to move. So do we really need our period? No. So your reproductive health takes a back burner.
Okay.
And so we stop having a period. So your hormone health or your hormone balance is thrown out of whack.
Okay.
So estrogen levels drop, stress hormones go up. So then you stop having your period. That's one of the first signs that, oh, actually, my reproductive health is a problem.
Okay.
Now, because I have low energy deficiency, my reproductive health is secondary now.
Yeah.
Estrogen levels are also plummeting. Then what happens to my bone?
Weekends.
Remember the estrogen that was boosting guys and suppressing?
Yeah.
Now the guys who are supposed to be suppressed
The sisu is
now have
reversed.
a party. And so your bone now starts to get resorbed or basically broken down. So particularly now in the gym, I've met a number of people. There's a big push towards high protein intake, which is excellent, and eat a balanced diet. And I love that narrative.
Yeah.
But then there's still that group of people who say, I'm going to eat at a calorie deficit and I'm going to work out and do this, that, and the other. to try and maintain this physique, but not knowing that you're actually harming yourself. So there's the one who is doing it because they want to fit into a particular size mold. Then there's the one who is doing it because their sport demands of it. And so they're definitely then damaging their bones. You get osteoporosis in your 20s or in your 30s. So I know the question was, what do we do about our hormone health?
Yeah.
So whenever we have issues with your cycle, you don't visit a gyna only when you're pregnant or when you have other issues. I think this is someone that you need to have. Every female needs to know, or at least have access to, reproductive health. Where am I at today? What is going on? What do I need to do? Am I having, regardless of whether you have a regular cycle and have no issues, or even if your cycle is irregular and you've had issues, I don't think it's one of those. There's no shame in, I'm going to see a gyna. Why?
Yeah.
I am just, I mean, you take your car to the garage
Yes.
for service.
Yeah.
It's running, but you take it.
Yeah.
So I think for females, that's an important relationship to have. Our relationship with food and what it is for us particularly, because it's a key component to every aspect of who you are. So don't shun certain food and say, but then I'll gain weight. I'd rather you eat it and then you do cardio, but then you're not starving your body of whatever it requires. But also activity. An active lifestyle in your youth definitely gives you longevity.
Okay.
Yeah.
Okay.
Yeah, I think.
Yeah, I think that's good.
Yeah.
And now just listening to what you're talking about, especially when it comes to sorry guys, I'm recovering from a flu. Especially when it comes to now reproductive health. With one, let me talk about other hormones, not just estrogen. Maybe you can touch on thyroid and how, because that affects metabolism. And then we can also touch a bit on weight management. So for individuals who are now getting on the Monjaros, the GLP-1s, let me not mention names, but the GLP-1s, how is that affecting their muscle and their bone health? And what would you encourage them to do even as they're on this medication?
So actually, very good question. So whenever we think of hormones, I think the first place we go to then for females would be your reproductive hormone.
Yeah.
But then thyroid, parathyroid, diabetes is a hormone problem.
Yeah.
It's an endocrine problem.
Yeah.
All these affect bone health. So your
Oh, thank you.
your thyroid hormone is directly linked with your bone health. I don't know if you remember signs and symptoms of
It was hyper graves, was it?
There was moans, groans, bones, and psychiatric overtones.
Okay.
Something like med school.
That's one I didn't get. That's mnemonic. I missed that one.
So when you're thinking about like now high thyroid levels,
Yes.
I hope I'm not lying to you guys and it's the reverse.
We'll put the actual image.
But these affect calcium metabolism, your calcium absorption.
Yeah.
If you have excess parathyroid hormone, it actively activates the cells that destroy bone. And so then if I have that skewed in that direction, then my bone is affected. If I am on drugs that suppress my thyroid, if I have high thyroid levels and I have drugs that suppress that, a constant suppression of what we call the thyroid stimulating hormone also affects calcium absorption.
Yeah.
The same thing with diabetes. It's a constant inflammatory state, which affects your gut health, calcium absorption, just affects your vasculature, which affects blood supply to your bones.
Yeah.
So all these things have a role to play. Now, the GLP-1 off-label use for weight control, I think has given very many people license to live a healthy life.
Yes.
I mean, there are those who've struggled with obesity and weight loss, and it's one of those we say it's a balance. So you're you're heavy and you would want to lose a weight and get moving,
Yeah.
but your joints hurt so much that you can't move. So where do we start in this journey? So I think that has given people a lot of license, to live the life that they want.
Yeah.
But it works by reducing your appetite.
Yeah.
So it works by reducing your food intake. So what does that do to your nutrient intake? So we definitely see a lot of muscle mass loss, because if I'm losing my daily dietary requirement, then I can't keep up.
Yeah.
I can't maintain. So we lose a lot of muscle mass. Bone health, not as dramatically.
Okay.
Or at least in the few patients I have seen in the clinic who have been on it, we've not seen a big shift in bone quality.
Okay.
Probably because they're also doing it when they're still within their 30s, 40s age group, and your bone quality at that point is not too bad. So maybe we may potentially see the actual and true effects on bone health down the road. But in that subset, if you're not eating enough to get your nutrients in, then supplementation is a good thing to do. You're eating less, your energy reserve is definitely less. So you'll struggle to move. You'll struggle to have, especially I think in the initial phases. I know of people who've been on it, but I've not had a conversation one-on-one with someone who has. So this is all from just reading.
Okay.
But their energy levels are low. So you will not be able to exercise much. But that little that you can do, please do, because then you need to keep stressing your bone, but you also need to work a lot on muscle strength.
Okay.
Because that tension we work out for toned muscles and a toned body.
Yeah.
But yes, it looks great.
Yeah.
You look amazing. But what is the actual functionality of that? The tension of that muscle on bone, that stress and that tension helps stimulate bone production, slow down bone resorption. So if I am losing a lot of muscle mass, my muscle is getting lax, my muscle is getting weak, that in itself will also affect my bone health. So I think power to those who are on it and have taken control of their life and those decisions and their decision to be healthy in that way.
Yeah.
Now we just need to add now the components of, yes, we've lost the weight. What else has it done to the rest of my body?
Yeah.
And so how do we compensate for that loss?
Okay.
Yeah.
Okay. And they should be happening concurrently. We recommend.
Yes.
All right. Now let's talk about the perimenopause and menopause around that period. What should we look at, focus on, just to make sure that as we step into menopause now, when the estrogen just says bye, at least bone health is something that we've been able to preserve so that we're not having the challenges later on in life. Yeah.
So if you're 20, start now.
Yeah.
If you're 30, start now. If you're 40, start now. So the ideal would be, in a perfect world, everyone started moving and started exercise in your youth. And you've built up that bank reserve to its maximum. And so as you then transition into that phase of my hormones now are, the seesaw has tipped in the opposite direction.
I love that analogy.
I have enough reserve that it can tide me over. So as I'm just supplementing and I'm continuing with my exercise routine, there's in your 20s and 30s, the push is towards high impact activity. Stress that bone, run, jog, hike, skip. When you get to your 40s, now, because we are not replacing as fast, the push is now more towards strength and conditioning.
Okay.
So can I maintain my muscle tension, my muscle strength, my muscle conditioning, so that then it's also pushing and stressing my bone in that regard. So if we maintain an active lifestyle, for me, I think that is number one. Okay. Of course, as the ortho, movement is life.
Yeah.
So for me, that's number one. If you can do that and build that culture on that lifestyle of movement, exercise, and then do the right exercises. So there are those who will come and tell me, I swim and I cycle, and I'm like, great, excellent. I love that you do that. It's excellent cardio. But we need something for your bone. So can we add a day in there where you're walking or you're running or you're doing just something high impact? Because we're doing a lot. Cardio is your heart. Your heart needs
fantastic.
But can we also add something for your bone?
Yeah.
So in the same breath, then for the woman approaching perimenopause, can we do strength related workouts? And it could be low impact, resistant bands, lightweight. There's now a big drive towards Pilates,
Yeah.
yoga. I know most people think yoga is stretch. And,
Holding those poses.
it requires a significant amount of strength.
Yeah, it
and
does.
you build over time.
Yeah.
And it's we're not asking you to go and do. I mean, if you can do the deadlift, great.
Yeah.
I mean, if you can do the squat, great. If
But
you
build your
can't,
way up.
just build your way up
Yeah.
and work with what you've got.
Yeah.
And the more you do that, then you'll realize funny pains you had, knee pain. You'd get up from a chair and you have to hold the sides of that chair to get up like your grandmother.
Yeah.
That goes away.
Yeah.
And you're more agile, you're more mobile. You feel more stable and more secure. I know people who going down the stairs is a very daunting experience just because they're not too sure if my legs will hold me or if they'll bail out as I go down.
Yeah.
And so if you can just work on that, then you just get up and go.
Okay.
So for me, the takeaway is move,
Yeah.
move. Eat well, eat right.
Yeah.
Supplement where you need to, particularly if you're approaching perimenopause and menopause, because now we need to now supplement a lot more seriousness than we do in our 30s.
Yeah.
For now, for us, I think in our age group, it's because it's now the thing to do.
Yeah.
But once you hit 40, you need to
needed.
do. Yeah.
Okay. Okay. Now, before we get to now the last segment where it's beyond the clinic, we're speaking earlier, and I had mentioned that I have a couple of friends who've gone through C-sections, and of course, to go through a C-section, you need spinal, which is the medication you're given to numb the lower half of your body so you can have the delivery. And after that, they complain of back pain. I think they call it spinal back pain. What do you recommend for management of that type of back pain? And maybe you can tell us why it happens.
Okay, so as I've had a number. I think I told you earlier that I've had a number of spinal injections for one reason or the other. And one, if you ever have the misfortune of seeing that needle, it's probably like
it's long.
It's long.
Yeah.
Okay. And the access point. So it's basically you're being stabbed by this very fine needle, but through very many layers of tissue. So we'll go through your skin, what we call the subcutaneous fat. Then we're going into the space between two bones in your spine. So there are ligaments that attach bones and there's tissue there. So think about it as like a tract or a wound or a cut straight through and back. Now, we can scar down. So the ones who get spinal with a very fine needle rarely will have a lot of scarring within that tract. But some, just again, depends on how you heal. You know, the guys who get keloids or what we call hypertrophic scars. So you tend to be a very enthusiastic scar former. And so you can get a lot of scarring within that tract. Now, scar, unlike normal ligament muscle, doesn't stretch. So they may tend to say, my pain is worse when it's cold or if I'm in a cold place. And it's because scar is tight. So that segment of your spine just feels very tight. Okay. Now, outside of just a lot of warm up and stretching, we can't do much about scar. But the most common cause of back pain, I wouldn't even say it's post C-section. So we will always attribute it to C-section because it was the trauma, the last trauma in that journey. But it's usually muscular. And it comes as a result of pregnancy. So you stand straight, then as your belly moves forward, your back the curvature starts. And your core muscles are stretched to within... I mean,
they're really stretched.
They are all the way out there. And so in the recovery phase, you find if you do not work pelvic strengthening and core strengthening to restore that balance, your back ends up being the workhorse. So your spinal muscles end up doing a lot of the work. But also if you do not condition and work on them after pregnancy, they do not go back to their pre-pregnancy level of function.
Okay.
And so now what you tend to get is actually muscular pain because of just weak back, core, and pelvic floor muscles.
Okay.
So for me, I think the message to all women, I think, as it were, whether you've delivered vaginally or you've had a C-section, your body goes through a lot. Your muscles stretch, your posture is shifted, the alignment of your spine. Pregnancy does a number, on the woman's body. And so there's post-delivery, yes, take care of baby and nurse baby, but I think take care of yourself. So this is where just stretching exercises, pelvic floor strengthening, core strengthening exercises, of course within reason. I'm not telling you deliver and go do this a week or 2 weeks down the road, but have that as a plan to go back. I think that will help. It helps a lot. I think the same way we talked about posture and sitting and guys, for the female it's the same thing. So take care of the baby, but you also have to pour into yourself as much as you did.
Yes, correct. And I hope all the young ladies who ask that question frequently, I hope this is going to be helpful, and that you can now try and focus on now that strengthening of your core muscles, your pelvic muscles. And I think also for pelvic muscles, they can have these conversations with their gynecologists for like what are some of the techniques they can use.
I think YouTube is the University of YouTube or the school. It's an excellent resource if you're able to find, because if you have access to a gym and you have access to a trainer, excellent. Of course, get one who knows what they're doing so that then you don't get hurt. But if you do not have the capacity to do that, or you do not have access to that, there are short videos on simple things I can do at home. Back and core workouts for beginners. Then you build up your skill level as you keep going. So now, before you'd say we don't have internet at home, so my age is showing, or you don't have access to the internet, you do not have access to a gym, and so how would I do it? Now,
Now you have access.
Now you have no excuse. You have it on your phone, you have it in the house, you have a floor, you have a carpet, you have a body.
Move it. Okay.
Mm.
We'll like to move it. We'll like to move it. Okay, let's go beyond the clinic now. Okay. So just a couple of questions, the same way we did at the beginning. Don't overthink them. Just answer with what's on your mind. All right. So let's say you had a time capsule and you could text a simple piece of advice that is actionable to your patients right now. What would it be?
Get up and move.
Say it to the mic.
Get up and move.
Okay. Correct. Enough said. Number 2. What's the first thing you do for yourself in the morning or the last thing you do for yourself in the evening that's simply for your own sanity?
So first thing, I pray.
Okay.
I would say the last thing as well. But I also like to sit in silence. So more often than not, we'll be in the evening. Just to decompress. We were talking about earlier. I'm very comfortable in silence. So I like a quiet car, a quiet house, which is very different from you. But just to decompress.
Okay.
Yeah.
That's good. Number 3, is there a moment either recently or at any point in time where you thought the body is really wild for doing that? Like, this is such a weird thing that the body can do.
Oh, that's so funny. Yes. Well, my work. So we'll talk about my work, but let me first. So once, I think it was probably my second trimester of pregnancy, and I decided to walk home from wherever I was. It was about a 1-kilometer walk.
Okay.
Not very nice sidewalks. So I was walking on the road. Then you know the way you have to get off the road at some point. And I remember taking a step, and then I couldn't move. and I had this sharp pain in my left back, the left side, lower back. And I literally kept, like, I would try to move my leg and I couldn't move. And so I was like, now I'm going to sit on the side of the road on a rock. So I remember laughing, and I just stood there. And so people are walking by and they're like, and I'm just like, I can't move. And I was like that for probably 5-10 minutes.
Yeah.
And then I lifted my leg tentatively and I shook it off, and I was like, oh, okay, we're awake now. Let's go. And the next day, I signed up for yoga, and I was like, this cannot be my life. But the fact that it could like there are car stalls in the middle of the road.
Yeah.
That was me. And I was like, what is going on? Now my work, I said I do a lot of sports surgery. So I do arthroscopy. So it's keyhole surgery.
Yeah.
Sometimes we have to stand in very weird ways.
Okay.
Assuming I need to do something. So
yeah.
a lot of, and your shoulders are up in the air depending. Now I work as a team.
Yeah.
And I am the shortest. Well, I'm the shortest in many rooms.
Yeah.
And so sometimes, like the bed height.
Yeah. Yeah.
And so there are times my shoulders are this way. And there was once I was holding something and my hand just spasmed.
Let go.
No, it spasmed. So
Yeah.
I'm holding it. And so I had to tell my colleague, please, just take it. But when we actually sit down and talk among people who do a lot of keyhole surgery, whether it's abdominal, joints for the orthopedic surgeon, the gynecist, you should know we are the ones who have back pain, we have neck pain, our shoulders hurt. So we test out our own products. When I'm telling you, go for physio, I have gone for physio.
Yes.
Go to the gym. I am in the gym 3-4 times a week.
Okay.
Take medication when if it hurts.
Yeah.
I mean, take it, of course, within reason.
Yeah.
Yeah, but the body is an interesting thing. It can just bail out on you in the middle of the road.
That's true.
And in the middle of surgery.
I think now that we've talked about that, and every time I ask people this question, it's very surprising that most times they're kind of it can be shock factor, but also like from the negative side and rarely positive. I think I've gotten a positive one today of just pregnancy, like how the uterus literally is a fist, but it can stretch to carry a whole baby, and sometimes a 5 kg baby.
I keep telling, I think there was once I was having, I think it was a conversation with my dad, and I was telling him, you cannot, I am a Christian.
Yeah.
I am a believer. And you cannot convince me that Big Bang Theory, after studying the human body, I'm just like, the marvel that it is and the things that it can do.
Yeah.
And the things that you can withstand that even science doesn't explain. It's a marvel.
And a fantastic one. Yeah. All right. And let's add the cervix there as well, because it also does extra work.
Yeah.
Okay.
When you see the head of the child, particularly if they tend to have big heads.
Yeah.
Like, oh, I knew I'm a superhuman.
Yeah, 10 centimeters is not small.
I'm a superhero.
Yeah.
Yeah.
And happy belated Mother's Day, by the way.
Thank you.
2 last questions.
Yeah.
What's a piece of health advice that you don't necessarily subscribe to anymore that you probably used to give to your patients or your community? That's one.
Okay.
And then the last question is, what's a health rule or something we go by in the health fraternity that you think we should all break every now and then, like just once in a while, just break that rule? Yeah.
Health advice that I used to subscribe to that I don't anymore.
Yeah.
That's a hard question. Not necessarily a rule, but I think, and this is probably pre-training. A lot of the time and I think a large part of our population is guilty of this, is whenever a doctor tells you you need surgery, okay, the first port of call is, this guy wants money, this girl wants money. And And I remember probably even in med school thinking that do they really need it? And do you really need it? And probably to be a relative who's been told they need surgery. But now, keeping a more open mind. So it's not a rule. I find that question very hard because...
No, but I get what you're saying. Maybe not a rule, maybe just a recommendation.
Yeah. So my recommendation actually, now the drive is actually, there's a lot of distrust and mistrust around, I think the word is mistrust, around doctors and the healthcare practice within our country. We are vilified.
And I think not just within our country, I think in multiple other countries as well.
Yes.
Yeah.
But now, speaking to our situation, someone is he's quicker to believe a foreign doctor than they are to believe you or me.
Yeah.
And yes, there are bad apples in every sack. There are bad apples, and I would not want to say that there are those of us who have not done shifty things.
Yeah.
Okay, but the vast majority are out there to
help,
to do no harm. Okay, but that, I mean, it's amazing how quick a patient will bolt out of a room when you bring up the word surgery, or how you need to have this injection and they will question and second guess. And for the work I do, sometimes time is a big factor, but not for majority of the cases. I mean, I'll tell you, go think about it, 3 months, 2 months, a month.
Yeah.
Prepare for it, ask the questions, come back.
Yeah.
But then there are those that, if I am telling you it is do or die, please trust that I have your best interest at heart. So I am now walking in those shoes. I think I am more open to, what have you been told? Okay, I suspect they have a good enough reason. The one thing I keep telling patients is question your doctors. So yeah, probably then that would be my answer.
Okay.
The question your doctors.
Yeah.
And question them to the full extent that you understand what is going on.
Yes.
Before, it was daktari amesema,
and that's it.
And that's it.
Yeah.
Or choose for me. I tell patients, please no. Question your doctor. And it all boils down to, when you have the information and you know what is, you are in charge and in control of your care. So I no longer subscribe to the doctor knows best. I do not purport to know everything about orthopedics.
Yeah.
If you come in with a foot and ankle problem, I will send you to the foot and ankle doctor. If you have a spine issue, back pain, I will see you. I will recommend physio. But if it goes beyond what I'm comfortable doing, I will send.
Yeah.
So the rule I have broken for myself is, do not fear to be questioned. So then that means you have to know your stuff and be comfortable to say, I do not know.
Yes.
And I have no monopoly over patients. I have no monopoly over disease. If I cannot deal with it, I will send it to someone who can. I see that a lot more now in the younger doctors.
Yeah.
I think because we are now more into a team approach as opposed to I am everything.
Yeah.
I'm hoping more and more people can do that. But please, Kenyans, women, men of all ages, question your doctor. They may hate me for saying it, but ask the questions, because it's your body, it's your health, it's your life.
Yeah.
Yeah.
Okay. Lovely. And what's one rule we should break every now and then? Health related.
Eat what you want.
Okay. It's always diet. I promise you, it's always diet.
Eat what you want.
Which is fine.
Yeah.
Yeah. Just put in the work to stay healthy after you've indulged.
Life is for the living.
Yeah.
Quite honestly. So the last year of my grandfather's life, we lived with him. And he had this. It was a laundry list of dietary restrictions. No meat, no salt, no. And so we did dinner with him at the table. I was in med school then. And I would turn, and by the time I turn back, my chicken is gone. And he's laughing sheepishly in the corner. And you look and it's like, I mean, you're alive. Eat the chicken.
Yeah.
You'll only be alive for a season. So I think some things are, we create these rules to increase or the longevity of your life. But am I adding days to your life, or am I adding life to your days?
I guess we'll find out.
Eat the chocolate. Drink the wine.
Yeah.
Eat the chicken. I mean,
of course, in moderation.
Yeah.
Yeah.
But do it.
It's for the life is
for the living.
Okay.
Do it. Yeah.
Thank you, Doc, for coming. We've reached the tail
you
end
so
of this.
much.
And now I'll give you the opportunity to introduce yourself if you want guys to find you.
Yeah.
Okay.
Like I said earlier, I'm Dr. Eva Langat. I'm an orthopedic surgeon. I run a clinic at the Nairobi Spine and Orthopedic Center. That's on Monday morning from 8:30 to 1, and Friday morning 9 to 1, and at Third Park Hospital on Wednesdays between 2 and 5 p.m. Yeah. Thank you so much for having me. This has been so much fun.
It really has. I've learned so much. I was just like, okay.
Yeah.
All right. So guys, thank you so much for tuning in. My name is Dr. Hope Simiyu. I hope you've learned a lot. Please be sure to like, to comment, to subscribe if you haven't subscribed, to ask some questions for Doc here. And if you do, I shall forward them to her directly. And I hope it has been as enjoyable and informative as it's been for me. Yeah, that's a wrap.